So welcome back everyone to our next session, which is going to be looking at the UK Rare Disease Framework. So for those of you familiar with this piece of work, it's been ongoing for quite some time. Back in 2019 at our Rare Summit at the Wellcome Genome Campus, we actually had the then minister who was responsible for the strategy and the framework, Nicola Blackwood. She did a presentation in 2019 and she launched a national conversation and was very much welcoming people to talk about their experiences and their hopes and wishes for the future of the framework. So we're now 2 years on, and that framework has been delivered, and we have that. But the next stage really is the more difficult stage, which is developing the action plans. What are we actually going to do to make the framework work? So with us today, we have Kath Bainbridge and we have Lauren Watson. Welcome. They're both from the Department of Health and Social Care, and they're both very much embedded and involved in the development of these next stage action plans. So I'd like to hand over to them. Please keep adding your questions and your conversation into the chat and the Q&A, and we'll take some of those questions later on. Thanks ever so much.
Thank you, Jo. I'm really happy to be here today. My name's Kath Bainbridge and I head up the Genomics Science and Emerging Technologies team within the Department of Health and Social Care. Our team has responsibility for rare disease policy, including the UK Rare Diseases Framework, which Jo has just mentioned, and I'm sure many of you are familiar with. And I'm joined by Lauren Watson, who's the Rare Diseases lead in our team. I'd like to start by thanking the organisers for the invitation to speak here and to update you on recent developments on rare diseases policy, but also for organising this amazing summit and bringing all of us here together today. Next slide, please, Lauren. I'll start off today by recapping briefly the history of how we got here. I'll then talk about the new Rare Diseases Framework and then hand over to Lauren to talk about the next steps we're currently taking to turn those plans into reality. So firstly and briefly, a little history. Many of you will remember the 2019 Rare Summit and may have heard Baroness Blackwood speak, who, as Jo says, was at the time the minister and continues to be a passionate advocate on rare diseases. At that time, work was already underway to update the previous rare diseases strategy, which had been published in 2013 with 51 commitments. The work included the National Conversation on Rare Diseases, which sought views of patients, their families, clinicians, researchers and patient organisations, and received over 6,000 responses. These responses were analysed and an editorial board of policy officials, representatives from clinical practice and patient organisations was formed to formally identify and refine the priorities and underpinning themes for the new framework. These ideas were further tested through conversations with key members of the community, patient organisations, clinicians, researchers and industry, the UK Rare Disease Policy Board and the Rare Diseases Advisory Group. So a lot of consultation went into forming the framework, which was published in January of this year. I'll now briefly outline the new framework. The UK Rare Diseases Framework sets out a coherent national vision for the next 5 years, with 4 key priorities and 5 underpinning themes, all flowing from the national conversation. The 4 priorities are faster diagnosis, increased awareness amongst healthcare professionals, better coordination of care, and improved access to specialist care, treatment and drugs. The framework also has underpinning themes vital for delivering our priorities: pioneering research, better use of digital tools, data and technology, national and international collaboration, policy alignment across government, and crucially, putting the patient voice at the centre of decision making. But while the framework sets out our high-level priorities for rare disease, it's our action plans that will ensure delivery. Each nation has committed to developing and publishing an action plan, highlighting steps they will take under each priority area to achieve the objectives of the framework. Each of the 4 UK nations are taking a distinct approach to developing their action plans, reflecting their unique healthcare systems and structures, but all have committed to some common principles: that action plans will include specific and measurable commitments under each priority area, be guided by the principle of working collaboratively across nations, be developed in close collaboration with the rare diseases community through additional engagement, and be reviewed annually. So as I said before, each of the 4 nations is developing its own action plan, and each is taking its own approach to doing so. In England, we have taken an approach where we have essentially invited the delivery partners to be part of a delivery group. So we meet every 6 weeks as a group to discuss the framework and how we're going to operationalize it. So what are we actually going to do to make this a reality? So we have 6 weekly meetings, and we've asked the delivery partners to put forward actions which are aligned to their own organisational objectives. We think that's really important to try and make sure that this happens, but have a really strong focus, obviously, on rare diseases. So the delivery partners are undertaking their own consultation. They're going out and speaking to patients and the rare disease community more widely, and they're forming actions which they're bringing to the delivery group meetings and discussing across the delivery partners. And so those meetings are really...
Sorry, can I just ask, can I just butt in? Because it's really interesting for us to know who the delivery partners are. So who are the people involved in the 6 weekly conversations?
So we've got a range of the key delivery partners. So this includes NHS England, Health Education England, Genomics England, NICE, MHRA, so a broad range of different delivery partners, the organisations that will actually be responsible for delivering on the actions. And we've asked them, as they develop their actions, to provide us with information as to how they're engaging the rare diseases community in developing the actions, and to provide information on the metrics that so what the action is and how they're going to measure it, and what the impact is going to be on the other side of it.
I mean, this has been a really poignant question for lots of people in the rare disease community about how do we actually measure the success of this plan. So, you know, you touched there on the idea of metrics, and I think that's something that feels very different about this plan compared to the plan from 2013. Something which, you know, we can really measure success by. How are we planning to do that? What's the ambition for metrics and for measurement?
So the ambition is that when we publish the action plan, so we're currently working to bring it together and draft it with the aim of publishing it early next year for England. So the aim is that when we publish the action plan, it's going to be really clear what the actions are, who owns them, and how we're going to the key milestones and how we're going to measure the success against each action. And in addition to that, we're looking at how we can measure at a higher level, so evaluate the impact of all of these actions together on the things that really matter, and that's the impact that they're going to have on rare disease patients. So we're looking at the moment about how we can best do that, because that is ultimately the aim.
The aim and the challenge, I'd imagine. It's quite difficult to imagine how we measure. I'm just checking with Lauren. Lauren, are you back yet? Nope. How are we doing, Lauren?
I am. I'm terribly sorry, Joe. I don't know what happened there. You can see and hear me?
I can hear you. Yep. Do you want to carry on?
I can try. I will definitely try. I'm sorry, I had to restart my computer.
So we've been having a good conversation about measuring metrics, about setting, setting out what the plan is, but how we measure its success. So I can see your slides now. If you'd like to take it from there, that'd be brilliant.
Well, I will fast forward, and hopefully we can still cover some of the content. I'm so sorry. So I was talking about how we had moved into the implementation phase of the framework, and to do this, we've set up 3 governance structures. We have at the high level strategic level, we have the oversight board, the UK Rare Diseases Framework Board, which brings together policy officials and NHS officials from each of the 4 UK nations to provide oversight at a UK-wide level of the business end, the operational side of things, which is really carried out by the nation-specific delivery and implementation groups. And these are responsible for developing and monitoring the nation-specific action plans. We also have the UK Rare Diseases Forum, which I'll speak more about in a moment, which is responsible for broader stakeholder engagement and ensuring that we're really engaging with the community at every step of this process. But before I move on to talk about the governance, I just want to say a word about public and patient voice. As Kath has highlighted, this is one of the underpinning themes of the framework, and it's particularly important for our team that we listen to the voice of the community at every level of the process. We realize that it's people within the rare diseases community, whether those are people living with rare conditions or their families or carers, have an immense wealth of expertise and knowledge on the topic to bring to us as policymakers. And we really want to be listening to the people whose lives are going to be most impacted by the policies that we're putting in place. So with that in mind, we have patient representation within our governance structures, where we have patient and also clinician representatives on the UK-wide framework board, as well as our nation-specific delivery groups. We also have asked our delivery partners to provide evidence of consulting with the community, both in developing and also in implementing, and I think Kath's probably mentioned, in monitoring the impact of the actions that they're putting forward. We're involving the community in evaluating the draft of the action plans. So just on Monday next week, we're having our first community roundtable as a sense check of the actions as they're being developed. And we're also going to be consulting with the community when it comes to evaluating the outcomes of the action plans. One of the primary mechanisms for engagement is through the UK Rare Diseases Forum, and this is our principal mechanism for engagement and collaboration with stakeholders representing the whole of the wider rare disease community. This consists of 2 parts. We've got a core group which meets twice a year, and then we've also got an online platform which many on the call might be familiar with for continuous engagement with the community. And this includes a wide range of content, but I just want to highlight particularly that we have some very active discussion boards around each of the framework's priorities, and I can guarantee you personally that those are fed back directly to the delivery and implementation groups and also the framework board, because that is one of my jobs, going through that very interesting discussion and summarizing that ahead of the board meetings that we have. Another one of our groups, and this is the one that we're particularly involved in, is the England Rare Diseases Framework Delivery Group. And this has there are similar groups in each of the 4 UK nations that are responsible for developing, agreeing and monitoring the action plan for England. We've got on that group are a number of delivery partners, which I've listed here, as well as our representatives who provide the community voice. And at the moment, the England Rare Diseases Framework Delivery Group is meeting every 6 weeks to discuss the proposed actions and draft the England action plan. As part of this process, we've developed a template which all of the action which all of the delivery partners have to fill in when proposing different actions that form part of the action plan. And here we've encouraged them to break down their actions into short-term pieces of work, provide evidence of incorporating the community voice, outline clear milestones and metrics, which Kath has mentioned, and link their actions clearly to the priorities and themes. And I won't go into this in great detail, but just wanted to show here a couple of the example, or a few of the example actions under each of the priorities that we've received from our delivery partners. I hope you'll see that some of the actions cross over multiple priorities, but I hope you'll also see here that there's a real genuine commitment from these from our delivery partners to effect real meaningful change for rare diseases. And under the topic of helping patients get a faster diagnosis, we've got a number of actions around the genomics medicine service within the NHS, as well as an action from our own Department of Health and Social Care screening policy team, looking at ways to make ways of improving the way the government makes decisions on newborn screening. Health Education England is leading the way on increasing awareness of rare diseases amongst healthcare professionals. And NHS England is piloting a digital toolkit for better coordination of care. And we have a number of actions on improving access to specialist care, treatment and drugs from some of the main players in this. I'm aware that I'm probably run us horrendously over time with my technical difficulties. So I will just say that in terms of where we are from here, this is our timeline, highlighting in green some of our community engagement activities. And I've just pulled out some of these here. We've got community roundtables coming up, an online questionnaire based on the draft actions, which is going to go live in November. And of course, our continuous engagement platform. So the big question, how to get involved. We'd love everyone to sign up for our online UK Rare Diseases Forum platform and offer your views through that. Of course, if you are somebody who's directly affected by a rare condition, I've listed a number of ways that you can get involved there. And we're also very keen to hear from stakeholders in other areas, research, industry, and the clinical environment too. So please do get hold of us via that email address that I posted there. I'm going to leave it there, and apologies again for the technical difficulties. Hand back to Jo, and thanks very much for your attention.
Thank you so much, Lauren. That was a great comeback. I've actually got two questions. The genomics session is just about to start on the other channel, so I'm going to ask two quick questions, but I think they're good questions. So one is from Rebecca Stewart from Rare Revolution magazine. She asks, with each country creating its own action plans, how are we going to ensure equity? Now, this was the discussion for our very first panel today, equity, diversity, inclusion. I think it's a very good question. How do we make sure that this is not a postcode lottery and that there is fair coverage across the country?
Absolutely. Kath, do you want to take it, or shall I?
So it's obviously something that is very much on our minds as we develop this. And we do have measures in place to make sure that we have coordination across the 4 nations. So through our framework board and the feed-in that we're getting through the stakeholder forum. It is something that we're very mindful of as we develop this, and some of our actions are very much focused in that direction. For example, looking at geographic coverage through some of the NHS England actions, for example. So a theme that we think is extremely important, and we continue to take into account as we develop it. Lauren, have you got anything to add on that?
Only to say that we meet informally quite regularly with our policy counterparts across the 4 nations. So in addition to all the formal proceedings that you'll see, there's also a lot of informal discussion going on around how to make sure that we align our action plans and that there's no duplication of effort, and that actions are applicable across the 4 nations where they can be.
Lovely, thank you. And one final question. So this came from Gillian Hastings Ward. and she was asking who are the patient representatives. Fortunately, somebody's answered that question in the chat. So Kerry Leeson Beavers, who was involved in the diversity and equity panel first off today, has said that she is one of the reps in that delivery group. So if anybody was interested to hear what do the patient representatives in that delivery group do, and how can we as patient representatives speak to them and have our voices heard, to maybe have a conversation with Kerry. I think you had a very clear call to action there, which was for people to get involved and to have a voice and to share their views, their ideas, their suggestions about how we move this action plan forward. Can you remind us, how do they get involved? What do they do?
So I've just posted a link to a Google form. At the moment, our online platform is invitation only, just to monitor traffic. But I've posted a link for you to put your email address in if you're interested, and I'll happily add you there. Otherwise, to follow up through our email address, which is gset@dhsc.gov.uk, and I'll pick that up as well.
So if people are dashing off to the genomics session now, just to be aware that we're downloading this session. It's been recorded. We'll edit it a little bit so that the technical bits are taken out, and then you'll be able to actually catch up with it later. So you'll see the chat and you'll get the links again. So thanks ever so much, both of you, Kath and Lauren. We will maybe see you in the networking session later. Wonderful. Absolutely. And good luck with the action plans. I realise it's a tough job. So thank you on behalf of our community. Bye.
Thank you, Jo. Thanks, everyone. Bye.
Thanks,
everyone.